Welcome! In this training module, we're going to break down the essential components of Chapter 2 of the EU's Medical Device Regulation. Think of this as your practical guide for getting a medical device onto the European market and, just as importantly, keeping it there.
So, let's kick things off with the foundational question. When it comes to a medical device on the EU market, who's ultimately on the hook for its safety and compliance? Well, as we're about to see, the answer isn't just one person or company. Chapter 2 actually creates a powerful chain of responsibility, and it's designed to ensure safety at every single step of the way. Here's how we're going to tackle this. First, we'll map out the basic pathway to the market. Then, and this is the big one, we'll meet the key players, the economic operators, and spell out exactly what their responsibilities are. We'll also touch on some special cases, cover the absolute must-have market access requirements, and then see how it all comes together to create that single, unified EU market.
All right, let's dive right in. You can think of this first section as establishing the rules of the game. Chapter 2 is, without a doubt, the definitive playbook for any company that wants to bring a medical device to patients anywhere in the European Union.
And here is the most crucial point to grasp right from the start. This chapter covers the entire life cycle of a device. This is not just about a one-time approval to get your product on the shelves. No, it's about the ongoing obligations for everyone involved in that supply chain, making sure that device stays safe and compliant for as long as it's being used. Okay, now we're getting to the absolute heart of the regulation. To be successful, you have got to understand the very specific roles of these key players, what the MDR calls economic operators. I can't stress this enough. Getting this part right is fundamental to your entire compliance strategy.
First up, we have the manufacturer. This is where it all begins. This is the entity that has the primary and, frankly, the most extensive responsibility for the device. From that initial spark of an idea all the way through to post-market surveillance, the buck really does start and, in many ways, stops right here.
So the manufacturer's duties, all laid out in Article 10, are just immense. I mean, this isn't just about building something. It's about proving it's safe through really tough risk management and clinical evaluation. That includes an ongoing post-market clinical follow-up, or PMCF. You're also responsible for all the technical documentation, the quality management system, basically the whole shebang. And at the end of the day, you assume the liability.
Okay, so what happens if you're a manufacturer located outside of the European Union? Well, the regulation says you must appoint an authorized representative. And let me be clear, this isn't just a mailbox service. This is a legally designated entity located inside the EU that acts on your behalf.
Now this is where things get really interesting, because we start talking about shared liability. The authorized representative's job is to verify your documentation and act as the main point of contact for EU authorities. But here's the absolute kicker. If that non-EU manufacturer fails to comply, the authorized representative is legally liable for defective devices, right there alongside them. They are on the hook.
Moving down the chain, we get to the importer. This is the first person or company that physically brings a device from a non-EU country and officially places it on the union market. You can think of them as the gatekeepers for any device coming from the outside.
If you had to sum up the importer's job in one word, it would be verification. You are the checkpoint. Before that device moves an inch further, you have to confirm the CE mark is present, the manufacturer is identified, and the labeling is correct, including its unique device identification, or UDI. You're also responsible for making sure storage conditions are right and for keeping a detailed log of any complaints or recalls.
And finally, we get to the distributor. Now this could be a wholesaler, a supplier, really anyone who helps get that device into the hands of a hospital, a doctor's office, or a pharmacy. They are the last critical link in the chain before it reaches the end user.
Just like importers, distributors have a serious duty to verify. They serve as another crucial checkpoint. The regulation uses the phrase, act with due care, which means you're actively checking for that CE mark, making sure the labeling is right, and, this is key, ensuring that any complaints you hear get passed immediately back up that chain. You're the final line of defense before a device gets to a patient.
So when you put it all together, you can see this whole chain of responsibility laid out pretty clearly. Each of these operators has a very distinct, but also deeply interconnected role. It's a system designed to ensure compliance at every single step, from the manufacturer's total control over the design all the way down to those final verification checks by the distributor.
Okay, so we've got the main players and their roles down. Now let's look at some specific rules for certain types of devices.
You see, the MDR isn't a rigid, one-size-fits-all document. It actually has specific provisions for unique situations, and a great example is how it handles single-use devices. Now, this is a huge point from Article 17, so listen closely. If you take a device that was intended for single use and you reprocess it to be used again, the regulation says you are now legally considered the manufacturer of that reprocessed device, and that means you take on all the manufacturer's obligations we just talked about, from risk management all the way to legal liability.
The regulation is also smart enough to acknowledge some other unique cases. For instance, devices that are custom-made for one specific patient, or devices that are only being used for a clinical investigation. These follow different pathways. They don't need a CE mark, but they still have to meet other very strict requirements that are laid out in the regulation.
All right, so with all those roles and special cases defined, what are the absolute, non-negotiable requirements a device has to meet to even be allowed on the market? Let's talk about the keys to entry. At the very center of all of this is the CE mark. And you have to understand, this is so much more than just a sticker. It is the manufacturer's official, public declaration that this device conforms to every single relevant safety and performance requirement in the MDR. To put it simply, no CE mark, no market access. End of story.
And Article 7 makes another point that is absolutely critical. It's not just about what your device does, it's about what you claim it does. Any claim you make, whether it's on the label, in an ad, or in the instructions for use, has to be provably true and perfectly aligned with the device's intended purpose. Misleading users in any way is strictly forbidden.
Finally, let's look at the ultimate goal here. Why go through all this trouble? Well, all of these harmonized rules are designed not just for safety, but to create and maintain a single unified market for medical devices across the entire EU.
And this quote right here from Article 24, this is the big payoff. This is the promise of the regulation. It means that if you do all the hard work, if you follow the rules and your device is fully compliant with the MDR, it can be sold freely across all EU member states. No single country can create its own special roadblock to stop you. That is the power of the single market. So we'll leave you with this question to think about. Now that you understand the rules, now that you understand the roles, I want you to take a really hard look at your own operations. Is every single link in your supply chain, from your authorized rep in Europe to your final distributor, truly prepared to meet these obligations? Because ultimately, your market access, and more importantly, patient safety, depends on it.